My name is Eric Ndaula. I am a team leader of KuchuCare, and I am a gay man living in Uganda. In 2016, I got raped. The sad part of it is that I didn't have anyone to talk to. I didn't know any health center I could go to, not a doctor, and suddenly not even my peers can I talk to, because I was not certain that they could not out me. Now, this came from the stigma that comes from the community, from the health workers, from the counselors. No mental health is specifically for LGBTQ persons in Uganda. When you look at the discrimination, it's so high, visibly by non-state actors and even state actors, suddenly even the doctors. When you look at the self-stigma that I have, and more than 1,000 people out there who identify as LGBTQ, these hinder them from accessing health care services. These are stones, these are barriers that more than 1,000 people out there who identify as LGBTQ actually have. But what if there was a solution? What if there was an app called KuchuCare? The KuchuCare app, with an option probably to find a health center near me, a health center that I'm certain that is friendly, a health center that I'm certain that I'm going to speak a doctor to a doctor that is friendly. The KuchuCare app has that option. The KuchuCare app has the option where you can speak to a doctor who's guaranteed friendly. The KuchuCare app has an option that I have a peer who understands my situation. I have a counselor who's not going to try to change me because of who I am, but is rather going to listen to me and advise me as a human. The KuchuCare app probably has a function where I can get condoms, where I can get lubricants, where I can get any health consumables that are going to help me in my healthy as an LGBT person and as a human. This is all important, but how are we going to measure the impact? Number one, we are looking at the number of visits that are going to be made through the app to the healthcare facilities. We're also going to look at the number of deliveries and also the number of LGBTQ people who are actually talking to the doctors through the app. But the biggest and the most important impact that we are looking at is reducing the prevalence of HIV, the prevalence of other diseases within the LGBTQ community that has been pushed to the margins, pushed to a limit that you cannot even walk when you have a health problem to the healthcare center because you fear what they are going to think about you. We are looking at around 15,000 potential people that could actually use this app. However, 2,000 actually 2,500 actually serviceable. But actually right now, as Let's Work Uganda, a team that I lead that is coming up with the idea of KuchuCare, we are serving 500 currently. And these are the first customers that we're looking at. When you look at our projections in the first month, we're not looking at any users or doctors on the app because we are going to be developing the app. The app is still in the prototype stage and I'm just showing it right there. But we're looking at least 25 of all of the total number of subscribers on the app to be able to actually use the services of the app. When you look at least this is going to be a gradual number that is going to grow, that in August we have at least 200 of the total number of subscribers to be able to get the app. This is 25% of the number of people that are going to be subscribed to the app. When you look at our financial strategy, this is a non-profit entity, and this is a non-profit project. But we shall look at least 25 friendly healthcare services that are going to provide services, but for a fee to at least subscribe to the app, for a fee of about 15,000 shillings per month. And in the 6 months, we shall at least have accumulated 2,250,000, just enough to run our program costs and operational costs for the KuchuCare app. Ladies and gentlemen, the most important part is that we are outsourcing most of the services on the app. Especially, we understand the fact that these services are actually existing on the market already. We have already IDI, Maldmay, Baylor, Uganda, and other service providers that are having these services for the LGBTQ population, but they are not really accessing them. Please. The status quo is we have a prototype, and it's right in the middle of us. This is the team. And I, Eric Ndaula, Bana Mwesige, Diana, and Peter, we are coming up with this idea. And we have complementing factors to help us do this. The milestones and our next steps, we are hoping to develop the app. in the first version of the app, and this first version of the app has 3 main features: talk to a doctor, finding a health facility near you, and getting deliverables. We also want to get at least 50 first users to go to the app, and also 50 doctors to use the app. We're also looking at least getting 25 of all app subscribers to actually use the app. More than 100%, we're looking only 25 to be able to use the app. And this is our ask. Our ask is 26,120,000. And this is going to do the app development and also have an encouragement and also focus on getting the users, getting the doctors, and getting the health facilities onto the app. Thank you so much for listening.